Hi, I'm Dr. Matt Hand. I'm a pediatric nephrologist and integrative medicine physician. I've been caring for children for many years with all kinds of different conditions, including kidney disease, but also almost every chronic illness that children can get. I'm here to talk really about why I want to do this, why it needs to happen. We're really struggling right now in our healthcare system. Our healthcare system, as most people understand, is broken. We have a certain way of doing things that really targets disease. It really targets focusing on the disease of the patient. And yet the problem with that is a number of the diseases that we're seeing these days just are not really well managed with just our current siloed approach to care. Patients are struggling, and we're seeing things in epidemic proportion. Children are now struggling with conditions that we just used to not see hardly at all. We're looking at rates of over 30% of anxiety and depression in the pediatric population. We're looking at insomnia at over 25% of the pediatric population. Chronic pain now is up to 30 to 35% of children, and that's being defined as pain more often than 3 times a week for more than 3 to 6 months. This was almost unheard of before. Headaches in children, 10 to 20%, particularly in the female population. We're looking at some kids between 5 and 10% having headaches almost every day of the week. Chronic daily headaches have become huge. They're having a profound impact on our pediatric population. In addition, we're looking at autism rates of somewhere up to 1 in 50 kids right now. This is beyond anything that we thought was going to happen or that was around 20, 30, 40 years ago. Were some of these things there? Yes, but not to the rate that we have them right now. In particular, looking at things connected to anxiety, depression, the neurobehavioral issues, attention deficit disorder being in 10 to 20% of the population. Children are really grappling with a lot of problems right now. And when we look at that, our current medical system basically puts them in a silo. And with that says, here, we're going to treat your condition. And we know it's just not working well. We're seeing things get worse, actually, over time. So we just have to. There really is no option anymore about whether or not we look at changing the healthcare system. Patients are frustrated. They are looking for information. Unfortunately, the information overload that's on the internet sometimes just isn't that good. And we, as the medical teams, have to start guiding them in a way that can be helpful to them. Well, that's hard because many of the medical teams are just not educated on this. They just haven't had enough information to look at anything but besides what they've been taught. And what they've been taught has been predominantly the use of nothing but medications. And we have to look at every modality that's out there. We have to look at everything that's a possible treatment option for these children. And that can be everything from mind-body therapies to food to exercise. All of these have to be incorporated into it. And the medical team needs education on this to understand how it can help children with these various conditions. Why else is this important? We'll take other chronic conditions. If someone has cystic fibrosis or diabetes or kidney disease, the rates of other comorbidities in these children are astronomical, even higher than they are in the general population. So yes, we've gotten good at managing patients with these conditions, yet at the same time, we're not taking care of the comorbidities, which are sometimes having as profound, if not more of a profound impact on the lifestyles of these children. Patients are frustrated. Practitioners are frustrated. We're looking at people just not happy with how their medical care is. They want someone to listen and they need information. And ultimately, that's our goal. We have to get this out to people. This is the why. The why is that we have to change the medical system. I'm determined to do that. We are determined to do that. We have to change how things are being delivered to the patients. It doesn't have to be a dramatic change. This is actually small shifts that will make the impacts that can really help people. If a child comes in and has a headache, and we know the 5 triggers for headaches are stress and sleep issues, food, meaning skipping meals or eating high glycemic loads, dehydration, and musculoskeletal pain, well, the medicines don't touch that. we are not going to get them better unless we address those 5 things, or whatever of those 5 things the child is dealing with. So we have to look at that, and we have to be able to address that with the family and openly talk about it and have deliverables to them so that they have something that can help manage these things. This is the why. The what and the how is the next part. We can do that. We're really good at the what and the how. We just have to get better at the why. And once we change this, we will be able to really change the healthcare system. I believe we can do it, and we have to. It's not really an option anymore. How do we not do this when parents are coming in and we know 50 to 75 or 80% are using some type of integrative techniques? We know this. This is what the data shows. When you have someone with an illness, 50 to 85% are using integrative techniques. It's not the minority of patients anymore. It's everybody. So if that's the case, we don't have a choice. It has to change. But it has to be changed in a good, strong, evidence-based, rational approach. This is really important. This can't be me standing on top of Mount Washington sprinkling powders on somebody, okay, in a toga. This needs to be a true change in how we deliver things. There's a lot of frustrations out there. There's a lot of people who are frustrated with this process. And I'm not just talking about patients. I'm talking about patients, practitioners. The whole medical community right now, for the most part, is getting frustrated. It's frustrating when you're a physician or a nurse practitioner or a physician's assistant or a chiropractor or a naturopathic doctor, and somebody comes into your office and you're trying to help them, and you have a limited number of tools to do that, and you feel somewhat helpless. Patients are frustrated because they're looking for something, and they want to talk with their physician or their healthcare provider, and they're not really sure how to address this. They get a lot of information. Half of it comes from their friend or their uncle or their hairdresser or whoever it might be is giving them information. And we have to be able to help them. We have to get the information out there that will be helpful to them. And we have to get it out there to them that this is not an alternative concept. This is not getting away from Western therapies, but this is about bringing all of these good things into your life. I say to kids all the time, do you think food is important in your health? And they look at me like, well, yeah. And I say, okay, well, what do you think you should eat? And they say, well, probably fruits and vegetables. And I'm like, yes. It doesn't take some crazy thought. It's about changing the perspective. It's about using simple motivational interviewing tools to get people looking at engaging in their health. And we need to teach the healthcare providers. We need to teach people how to do this. We need to get people expecting these discussions are going to occur when they walk into their doctor's office or their nurse practitioner's office or their chiropractor's office. Whoever it happens to be that these discussions are going to happen. This is really, really, really important. To get past these frustrations, particularly, we have to have educational programs that let people know what they can use, and that they can use it based on information and data that's out there, and look at the preponderance of the evidence that points us in a direction in terms of what's beneficial to them. We have to stop siloing the disease. We have to stop saying, you have this condition and we're going to take care of this, not that we're going to take care of you as a person. As I have said many times, if your anxiety is worse than your diabetes, you're not going to do well just taking care of your diabetes. It just doesn't work that way. And we have to find ways for this to manage it, to be managed, so people feel engaged and the providers feel engaged and everybody is working together to make this happen. When you do this, well, what's out there? What are these modalities that I keep talking about? Well, it's very simple. Anything can be a treatment modality, anything. My bulldog Omar is a treatment modality. When he comes in and sees patients and slobbers on them, it's a treatment modality. The kids love it. They can't get enough of him. That's a treatment modality. But it really gets broken down into certain concepts. If you can forget everything else, it's about looking at the health in your life. It's about approaching every movement, everything you do every day to be a healthier individual. It's what you do, what you eat, what your exercise is, what you watch on TV, how much time you spend behind your phone. Whatever it happens to be, all of those things play a role in our health. But there are really certain sort of basics that I say. The first I talk about is conventional medicine. You have to have good conventional medicine or you won't, it's imperative. We can't throw that out. And I get really frustrated, and I tend to be somewhat controversial on this because some of my integrative colleagues get, they sort of are, we're not sure we should do this, or, they get sort of against the concept of conventional medicine. Conventional medicine is critical. You have to be good at that, and patients have to expect they're going to get good conventional medicine wherever they go. But that's one modality. Your food and your nutrition is another modality. Movement and exercise is another modality. Stress reduction, mind-body therapy, self-hypnosis, guided imagery, yoga, these are modalities that are used to calm the mind, calm the brain. If we can do just 3 things, improve our food, move a little more, and lower our stress, we impact 100% of our patients. 100%. I don't see how we don't understand this, okay? I just don't. But other things, supplements or herbs or botanicals can be used to supplement what we're doing with our food. Acupuncture or Chinese medicine is wonderful for treating some pain conditions and can be incorporated into what we use. Spirituality, the concept of who we are in this world with all of the things that we deal with on a daily basis. Who we are is the most important thing. It's more important than anything else. What's our purpose in life? And everybody who has these, is grappling with these conditions, is struggling with this. How do we address this? How do we somehow find a way to feel like people are becoming who they're supposed to become in this world? We ignore that a lot of times in Western medicine because we're not always sure if we should address it sometimes. Do we feel comfortable with our own spirituality? Having said it, it's important to patients, it's important to people, and it's a modality that we have to think about. Manual therapies such as osteopathic manipulation, chiropractic, physical therapy, these have now become really ingrained in our healthcare community. They can be tremendously helpful. Do they fix diabetes? No. But if your back hurts and it keeps you from moving, fixing your back or helping your musculoskeletal pain will get you up and help you move, and that will help your diabetes. This is about putting everything together, and it's the why. We don't have a choice anymore. We have to do this. So as we talk about the why, what are the numbers that are out there? We say, well, people want this and they're looking for it, but what are the actual numbers? If you go back to 1997, about 1/3 of all adults were using some form of complementary and alternative medicine. And if you go back to about 1990, there were about 420 million visits to some form of an integrative provider. Go 7 years later, and you're up to 630 million different people that are visiting integrative medicine providers. That's almost a 50% increase from what it was in the past. The amount of money that's being spent on this, in 2007, there were $14 billion that were spent out of pocket that were used just to treat pain alone. And when you expanded that to all different integrative reasons for the use of integrative techniques, there was almost $34 billion that was spent out of pocket. These are numbers that come from the National Institutes of Health. In 2016, the numbers were roughly $44 billion were spent on herbs and supplements alone in the United States. These numbers are staggering, just staggering. And remember, this is people going out and looking for this. This is before the medical, for lack of a better word, the Western medical community has actually even accepted or been involved in this. This is patients searching this. I always say, if 50% of your patients had hypertension, would you learn about it? If 60% of your patients had diabetes, would you learn about it? If 50% of your patients had cystic fibrosis, would you learn about it? Well, of course we would. And yet we know this number of patients is actually going out and using integrative techniques, and we're not really learning about it. We're not really investing in this. But this is the why. This has to change. We really don't have much of a choice anymore. If you look at well visits for adults, on average 40 to 60% of adults are using some form of integrative care. If you expand that into the pediatric population, somewhere between 15 and 30% are in well clinics are using some form of integrative care. If you add one condition to it, you're now talking about between 50 and 85% of those patients are using some form of integrative care. And this is very clear. If you look at, for example, in the asthma population, 30 to up to 90%, 80+% of people are using some kind of integrative care. If you look at the GI conditions, Crohn's disease, the inflammatory bowel diseases, functional abdominal pain, you're now looking at over 50% of people are using some form of integrative care. If you look at the autistic population and their families, again, over 50% are using some form of integrative care. If you look at the cystic fibrosis group, you're talking about at any one time over 70% may be using some form of integrative care. This is the majority of our patients. This is no longer just the few out there that are throwing in a few vitamins or looking for some alternative care. They're using it, and this is really interesting. If you look at some of the data, particularly in cystic fibrosis, they come back and they say 85% of them say that it helps. Now, you can argue the studies on it, but they're telling you that it helps. And interestingly, particularly in this one study, almost every patient still stayed with their Western therapies. That's a huge aspect to this to understand. A lot of times you hear the Western doc saying, like myself, I'm a Western doc, saying, oh, they want to do this and not this, or they want to do that and not that. No, actually most patients are actually looking to integrate what's going on. They're not completely opposed to the use of Western therapies. Yes, some people will argue that, but that's the minority of the patients by far. As a matter of fact, I argue that I have more success getting people to use Western therapies because I integrate things in. Because some of the things that I use will actually lower the side effects of the things that they're dealing with from a Western medicine standpoint. If someone can't sleep because of their medication that they're on, the mind-body therapies, the other modalities that I use to help them sleep will help them with the therapies that they need from a Western standpoint. This is critical. If you want people to be more compliant with what you're doing in a Western medicine world, you're better off bringing in integrative techniques so they blend it together. If we put these together, this is what we're going to have. And this is going to optimize our healthcare system. And this isn't about 2-hour visits in the office. This is about staying in our current model. We can't change the volume model. It's not going to change overnight. But we can clearly improve the value. There's no doubt to that. Docs say to me all the time, well, the patients just want a medicine. And I say, no, they want a treatment modality. And when you open your toolbox, your option is a medicine. If you don't have another option, then your thought is all they want is the medicine. That's not the case. And that's why when we look at this, this is the why. This is the absolute why. The numbers of patients, what they're looking for. The fact that these conditions that we're talking about, anxiety, insomnia, chronic pain, we don't have good Western therapies for this. We just don't. We have some things that can be helpful. I'm not saying that. But when you look at the bigger picture, we have to bring these other treatment options in order to take care of what now is the majority of the patient population. That is the why. So one of the big things that we deal with from an integrative standpoint and was really being looked at more even in Western medicine is this whole concept of perfecting versus personalizing care. We've gotten really pretty good at perfecting care. If you look at conditions, we look at what the hemoglobin A1C should be, or what your peak flow should be, or what your lung capacity should be. We've gotten good at looking at inflammatory markers and trying to perfect the little pieces of our care. But what we haven't really done is really personalized care. And that's a problem for a lot of patients because they feel like things are very fragmented. Our current system basically says, here is your condition. And I know I'm generalizing when I say this, but having done this for a long time and talked to a lot of people, both patients and practitioners, they all say the same thing. We basically say, here's your condition and this is your silo. So you see your kidney specialist for your kidney disease and your psychiatrist for your emotional issues and your GI doc for your Crohn's or whatever it might be. And each of these are siloed out. And then what we say is, well, if you have A, you get B, and C is the outcome. And this concept of reduction theory is really what Western medicine has been based on. And almost everybody that practices knows, well, that's just not how it really works. It's actually unusual to have A get treated with B and C be the only outcome. Even if it's something as simple as treating an infection, where you get an antibiotic for something and then say, well, here's my antibiotic to treat this infection. But then you get diarrhea from the antibiotic, or maybe you miss a few days of school and then you try and get back into school and you're like, wow, I'm behind. And then you get a little bit more anxious and then your symptoms get a little worse. Your belly pain might get worse. Your headaches or your breathing might get worse. This is really what happens in medicine. Patients who come in who have inflammatory bowel disease may have their disease go into remission, yet their pain doesn't go away. This is complexity theory, not reduction theory. Western medicine is really based on sort of this concept of reduction theory. It tends to be very fragmented, and patients feel fragmented. You'll hear them say this all the time. Well, this person said you got to talk to them for this, or this person for that. I mean, and they're like, yeah, but you're my doctor. Why aren't you helping me with these different things? And it doesn't mean we all have to be a jack of all trades. It just means that we have to be cognizant and understand that things are going to happen, and that the patient isn't just their condition, that they are actually themselves. They are a person trying to live in this world. And I know that sounds like an obvious statement. My mom says I have a keen sense of the obvious. But the reality is we have to look at the bigger aspect of who they are and not fragment them or silo them. You know, I tell the story, part of the reason I got involved in this is at one point I had all these transplant patients and we had transplanted them and their numbers were perfect. They looked awesome. Their creatinines were normal, their immunosuppressive levels were normal. Everything was just, they couldn't have been any better. And yet my nurse kept calling because she said, well, this person can't get back to school, and this person can't fall asleep, and this person's having joint pain, and this person's blood pressure's up, and this person's having panic attacks. Some of these patients were to the point that they actually said, I'm not going to take these meds anymore because I don't know what it's like to be a well person. And I don't know what it's like to have to not just target one thing, but my whole self, my anxiety, my sleep, my insomnia. And I thought about it for a second and I said, this isn't one patient. And I knew it was going to happen. When we put people on certain medicines, things happen. When they have certain conditions, things happen. Your anxiety may go up, your sleep may change, your attention deficit may get worse, your OCD symptoms may get worse. We know it's going to happen. We can predict it with almost 100% certainty, which we can't do with almost anything else in medicine. And yet we still silo them and we put them into trying to perfect the area of care that we take care of, rather than being proactive and really looking at it. And really looking at it and talking about it up front with the patient. So when they come in from the beginning saying, hey, what are you eating? You know, let's talk about your food. Let's talk about how you're eating your food with a healing intent. Let's talk about your movement. Let's talk about what you're doing for stress reduction as you go through this process. Not have it be something that's sort of off to the side or wait for the fire to start burning, but actually be proactive with this. It doesn't take much more time and can make a huge difference for the patients. And this concept of perfecting care has led us away from personalizing care, looking at what the patient actually needs for them as a person, not as a condition. And the big part for integrative medicine is going back and saying, how do we personalize this? How do we really look at this for this patient? Yes, we know what they need from a medication standpoint and what have you, but how do we take care of that person? My nephrology patients, my kidney patients say to me all the time, Matt, you never talk about my kidneys. And I say, well, your kidneys are sometimes the easiest part of all of this. The hard part is how do you become who you're supposed to be? And that's the personalization of the care. I can't tell you how excited I am for the launch of this line. I have been waiting for this for years. I actually was hesitant in the beginning when I started thinking about doing this. And then I realized, wow, what an opportunity to really change how we take care of our kids. This was a unique opportunity to really bring out stuff that can be helpful. And I been working with the team, and I'm so excited for this to come out. This is a very unique and terrific opportunity to help us to really help our children right from the get-go, early on in life, and help them throughout their life. And I'm very excited for this line to launch.